Lexapro is an antidepressant belonging to a group of drugs called selective serotonin reuptake inhibitors. Lexapro is available in 5, 10 and 20 mg tablets. The active ingredient of Lexapro is Essitalopram. What is Lexapro and what is it used for? Lexapro is used to treat depression and anxiety. It works by helping to restore the balance of a certain natural substance in the brain. It may improve your energy level and feelings of well-being and decrease nervousness. Lexapro prevents the reuptake of serotonin, which results in more serotonin in the brain to attach to receptors. Drugs in this 3 class also are used for treating obsessive-compulsive disorders and panic disorders, although Lexapro is not approved for these purposes. Things to know before using Lexapro include: before taking Essitalopram, tell your doctor or pharmacist if you are allergic to it, or to citalopram, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of personal or family history of bipolar manic depressive disorder, personal or family history of suicide attempts, liver disease, seizures, intestinal ulcers, bleeding or bleeding problems, low sodium in the blood, personal or family history of glaucoma. Escitalopram may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Before using escitalopram, tell your doctor or pharmacist of all the drugs you take and if you have any of the following conditions: certain heart problems, family history of certain heart problems. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. This risk may increase if you use certain drugs or if you have conditions such as severe sweating, diarrhea, or vomiting. Talk to your doctor about using escitalopram safely. This drug may make you dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana. Before having surgery, tell your doctor or dentist about all the products you use. Children may be more sensitive to the side effects of this drug, especially loss of appetite and weight loss. Monitor weight and height in children who are taking this drug. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. This medication passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. How is Lexapro used? You should always use your medicine as recommended by your doctor. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning or evening. The dosage is based on your medical condition, response to treatment, age, and other medications you may be taking. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device spoon. Do not use a household spoon because you may not get the correct dose. To reduce your risk of side effects, your doctor may direct you to start taking this drug at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Also, you may experience symptoms such as mood swings, headache, tiredness, sleep changes, and brief feelings similar to electric shock. To prevent these symptoms while you are stopping treatment with this drug, your doctor may reduce your dose gradually. Consult your doctor or pharmacist for more details. Report any new or worsening symptoms right away. It may take 1 to 2 weeks to feel a benefit from this drug and 4 weeks to feel the full benefit of this medication. Tell your doctor if your condition does not improve or if it worsens. What are the side effects of Lexapro? Nausea, dry mouth, trouble sleeping, constipation, tiredness, drowsiness, dizziness, and increased sweating may occur. If any of these effects persist or worsen, tell your doctor promptly. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including decreased interest in sex, changes in sexual ability, easy bruising, bleeding. Rarely, males may have a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using this drug and get medical help right away, or permanent problems could occur. The ingredients in this video are taken from the drug's package insert. If the video was useful for you, please like the video and subscribe to the channel. I wish you healthy days.